Hello. I'm going to present to you a short video intended to help increase your understanding of the basics of neurostimulation therapy. Specifically, this video focuses upon explaining the physiological function of neurostimulators. It covers the effects of changing various neurostimulator device settings and the biological relevance of doing so. The intent of this presentation is to help you strengthen your understanding of the fundamental principles of neuromodulation. At the end of this video, a short overview of neurostimulator troubleshooting will be conducted, and will integrate the content presented throughout the video. This presentation is intended for any care provider involved with neurostimulation therapy, whether implanting, programming, or troubleshooting devices. The video is presented in three main segments, the first being a general overview of neurostimulation and short review of neurophysiology. Part 2 focuses upon the physiologic effects of changing neurostimulator device settings. Lastly, Part 3 provides an overview of the technical aspects of neurostimulation, including device troubleshooting and electrode circuits. Part 1, Neurostimulation. Before covering neurostimulator device function, it is important to review a key concept in neurophysiology, the action potential. Here we have a neuron. If you examine the cell membrane of the neuron, we would find various ion channels. These channels permit the passive passage of ions into and out of neurons along differences in ion concentration and electrical charge densities. Using specialized techniques, the membrane potential or membrane voltage of a neuron can be recorded over time. Membrane voltage can be thought of as a difference in the amount of ions or charges across the membrane. Therefore, membrane voltage changes as ions enter and exit cells through ion channels. Neurons are specialized cells that have a threshold voltage that, when reached, causes the cell to fire an action potential by triggering voltage-sensitive ion channels to open in a chain reaction of sorts. An example of this threshold voltage is indicated by the dashed blue line on the graph. Therefore, as ions gradually move inside a neuron, the membrane voltage will change. When this makes a cell more likely to fire, it's called depolarization. Once depolarization occurs, enough that a cell reaches its threshold voltage, an action potential will fire. The chain reaction of ion channels opening travels down the neuron, causing it to release neurotransmitters, producing its intended action. The device only pumps ions when it is on. This is represented in the stimulation signal by the upward steps in the waveform. Watching the green bar as it moves along the stimulation signal and watching the electrodes demonstrates how the device pumps out charge in an on and off fashion. Random ion movement is always occurring. Usually, the amount of ions moving into a neuron balances the amount moving out, so no noticeable change in membrane voltage occurs. Powering on the neurostimulator, however, causes charges to be pumped into neurons. These extra charges entering the neuron cause the membrane voltage to change. At one point, depolarization will occur and eventually reach the threshold voltage, causing the neuron to fire an action potential. Taking another look at this, with illustrations not to scale, we can see the relationship between membrane voltage and neurostimulator signal. The upper graph shows a typical neurostimulator signal, while the lower graph shows membrane voltage, with threshold again represented by the dashed blue line. When the neurostimulator is on, charge is pumped out of the device and into the neuron, causing the membrane voltage to increase. In this case, it reaches threshold of the neuron. As a result, the neuron fires an action potential. Looking at the plots of the neurostimulator signal and membrane voltage, you can see specific areas beneath each curve are shaded in yellow. The yellow area of the neurostimulator signal is related to the amount of charge the neurostimulation device pumps out and into the neuron. This then corresponds to the amount of voltage change or depolarization seen in the neuron. This is a significant concept in neurostimulation and is the foundation for information on programming presented later. Changing the settings of a neurostimulation device has physiological implications. Amplitude, or the strength of the stimulation waveform, is one neurostimulation parameter that can be adjusted. Generally, increasing amplitude increases nerve recruitment, or the number of nerves being stimulated. Continuing with the comparison between neurostimulation devices and pumps, increasing the amplitude is similar to increasing the rate or speed that charges are pumped out of the neurostimulation device. This also enables the charges to be pumped farther into tissues, much like increasing the flow through a garden hose enables it to be sprayed farther. A good way to visualize this would be to think about listening to a stereo in a room. If the volume or amplitude of the sound is low, you will only be able to hear the music if you are close to the speaker. This is the same for neurostimulation. With a low amplitude signal, it will only be able to stimulate the nerves that are closest to the electrode. Increasing the amplitude of the signal, however, enables nerves farther away from the electrode to be stimulated. Just like increasing the volume of a stereo enables you to hear it from across the room. Lastly, keeping in mind that the area below a stimulation waveform is related to the amount of charge pumped out by a neurostimulator, it is clear that a low amplitude signal, compared to a high amplitude signal, pumps out less charge per waveform, as indicated by the areas shaded in yellow. Pulse width is another parameter of neurostimulation that can be adjusted. Increasing pulse width also generally increases nerve recruitment, or the number of nerves being stimulated. It does not, however, increase the area over which stimulation occurs. Again, going by the pump analogy, increasing pulse width is like increasing the time the pump is left on. In other words, pulse width is the time the neurostimulator pumps out charge. With regard to recruitment, pulse width generally is used to stimulate more nerves in a given area. This area is more or less determined by amplitude, which we discussed previously. Normal nerve recruitment occurs in an order based upon neuron size. The thickest neurons are the easiest to depolarize and fire with stimulation, while the thinnest neurons are the most difficult. This is where pulse width can be useful. For example, take this thin neuron. When the neurostimulator pumps out charge, the neuron depolarizes somewhat, but not enough for the membrane to reach threshold and trigger an action potential. Again, this is because thinner neurons are harder to stimulate. If the pulse width of the stimulus is increased, the neurostimulator pumps out charge for a longer period of time, causing the neuron to depolarize more until membrane voltage reaches threshold and triggers an action potential. Again, pulse width can be increased to help recruit additional neurons with smaller diameters. Thinking back again to the relationship between waveforms and membrane voltage, as indicated here by the yellow shading, we can see that a shorter waveform produces less of a change in membrane voltage compared to a waveform with longer pulse width. Again, it is important to remember this is because the area under the stimulation waveforms are related to the amount of charge pumped out by the neurostimulator, which is what causes membrane voltage in neurons to change. Understanding the relationship between stimulation waveforms and the amount of charge that the neurostimulator pumps out is central to comprehending how stimulus parameters impact battery life. Specifically, stimulation waveforms can be optimized to help extend the battery life of neurostimulation devices. First, starting with any given pulse width, the stimulation amplitude can be adjusted until the desired response is observed. This point is referred to as the response threshold. It may be the firing of an action potential for a single neuron in a laboratory study, or a physiologic response such as a muscle contraction in a clinical setting. Repeating this process, many different combinations of pulse width and amplitude at the response threshold can be found. Plotting these points together, the resultant curve shows what optimal stimulus parameters are with regard to battery life of the device. Of course, other stimulus waveforms can be used. However, these stimulation signals cause the stimulator to pump out an excessive amount of charge. Therefore, the ideal stimulation waveform is one with a mid-level pulse width and amplitude, minimizing the amount of charge pumped out by the stimulation device. The reason being that as batteries store charge, reducing the amount of charge pumped out with each stimulation cycle helps prolong battery life and the interval before the device needs to be replaced. Pulse rate is the final major parameter of stimulus signals that can be changed. This is simply the number of times the neurostimulation device produces a signal within 1 second. In other words, this is how often the charge pump switches on and off. Changing the rate of the neurostimulation device changes the frequency at which neurons are stimulated and fire action potentials. This can be increased and decreased based upon a variety of factors such as patient comfort or therapeutic efficacy, just to name a few. Practically speaking, changing stimulation parameters can change patient sensation with neurostimulation. With sacral nerve stimulation, patients report sensations in the perineal region. As the stimulation cycles on and off, patients will be able to tell the device is working and will often describe the feeling as a thumping when the device is set at a low rate. Increasing the amplitude of the stimulus will cause patients to feel a stronger sensation in the perineum, which they may also note to be present in the surrounding areas. This is the result of the excitation of nerve fibers farther away from the electrode due to the increased amplitude of the stimulus signal. Increasing the rate of the stimulus will cause patients to have a change in sensation from a thumping at a low stimulus rate to a fluttering at a higher stimulus rate. Now that the basics of neurostimulation have been addressed, it's time to cover a few advanced concepts and apply the basics to troubleshooting and understanding device function. Neurostimulators work by pumping charges out of one electrode and collecting them through another. Without the two electrodes, electrical current would not be able to flow, as no complete circuit would exist. One electrode configuration, referred to as the bipolar configuration, utilizes two electrodes at the end of the implanted lead. Again, one electrode pumps out charge from the device, while another electrode collects it. This produces stimulation in neurons that are close to the lead. The yellow shading indicates the area of stimulation when using a bipolar device configuration. The darkest coloration directly around the electrodes illustrates how only the neurons closest to the lead will be stimulated. This selective stimulation is a benefit of bipolar configuration, allowing relatively precise stimulation of targeted nerves and minimal excitation of other nearby neurons. Monopolar stimulation is another method of configuring the neurostimulator device. In monopolar stimulation, charges flow between one electrode on the lead and the neurostimulator case. In other words, the neurostimulator case acts as one of the two electrodes required in the electrode pair. Monopolar stimulation stimulates slightly farther away from the lead than bipolar stimulation. This may make it easier to stimulate a target nerve, but it is less specific in doing so, being more likely to excite other nearby neurons, which may also produce undesired effects. Taking a closer look at the lead, it is clear that there are multiple electrodes that can be used for stimulation. Choosing two electrodes that are directly adjacent to one another will produce the smallest and most precise area of stimulation. This will afford the most specific stimulation of target nerves and reduce excitation of other neighboring neurons. However, with such a small stimulation area, it may be difficult to even excite the intended target of stimulation. Selecting a pair of electrodes with greater spacing will produce a larger area of stimulation, exciting neurons farther away from the lead. However, it should be kept in mind that this increased electrode spacing produces less precise areas of excitation, possibly making stimulation less specific by activating not only the target nerves, but also other nearby neurons. To review, monopolar stimulation excites a relatively large area around the lead, facilitating the excitation of target nerves. However, because of this relatively large area of excitation, monopolar configurations are less precise with regard to selectively stimulating the target nerve and not exciting other nearby neurons, which may produce undesired effects. Bipolar stimulation provides the ability to more precisely control the area within which nerves will be excited by stimulation. Generally, only nerves near the lead will be stimulated with this configuration. Again, a bipolar stimulation setup enables more specific stimulation of target nerves, reducing excitation of other nearby neurons by confining the area within which neurostimulation excites. Now that electrode configurations have been covered, a brief overview of how to utilize electrode pairings to optimize neurostimulation can be presented. As bipolar electrode pairing offers the most specific stimulation and will generally only excite target nerves when leads are close to these cells, using a bipolar electrode configuration during lead placement helps optimally position the lead by requiring it to be closer to the target nerves to produce the desired effect. When positioning the leads, the amplitude and pulse width should be set to a value in the middle to low range of that available in the neurostimulation device. This is suggested as stimulation with low amplitude and low pulse width will require the electrode to be close to the target neuron in order to excite the cell and produce the desired effect. Placing a lead with stimulation set to a high amplitude and large pulse width will enable the excitation of the target nerve to occur despite suboptimal electrode positioning. While at first this may seem beneficial, it is in fact a setup for failure. As electrodes become encapsulated by the body's natural response and shift slightly with respect to the target nerves, stimulation parameters will need to be increased in order to maintain the desired effects. If a device is placed with parameters already near their maximal values, there is little room to increase stimulation to overcome these physical phenomena. Thus, leads should be placed with stimulation parameters set to mid to low range amplitude and pulse width in order to not only optimize lead placement, but also provide the ability to increase signal strength from the device as needed. Before reviewing impedance and the role it plays in device function, a brief review of basic electronic circuits is called for. Here you can see a simple circuit. The battery provides power to the load, or resistor, in the circuit. This resistance could be something like a stereo speaker, or it could be a light bulb. However, in the case of neurostimulation, this resistance is in fact the tissues of the body. The reason being, the charges produced by the neurostimulator must traverse cells or the extracellular space as they exit one electrode of the neurostimulator and enter the other. These pathways are not very conducive to current flow or charge movement and thus resist this phenomena, which is why they can be considered a resistance or impedance. For the sake of this tutorial, we will use the word impedance rather than resistance to describe this aspect of neurostimulator function. Applying this basic concept to a neurostimulator, there are three main impedances involved in the system. When assessing the impedance measured by the neurostimulator device, the total of these three impedances are measured together. The first is the lead impedance, or impedance of the wire that connects the implantable pulse generator to the electrodes. This is outlined in blue. This impedance is generally very small in comparison to the other two impedances in the circuit. However, if a lead becomes damaged, this impedance will change drastically, which we will discuss on another slide. The second impedance, and usually the largest, is the electrode impedance, highlighted here in orange. This is the metal tissue interface where charges carried in the wires of the stimulator device are transformed into ions which can then move through the tissues of the body. This impedance results in part from an electrochemical reaction that occurs at the electrode tissue interface, and as a result, is much larger for smaller electrodes. The third impedance, integral to neurostimulation, is tissue impedance, which, as mentioned earlier, is simply the resistance to flow ions encounter as they move through cells and the extracellular space from one neurostimulator electrode to another. Impedances can be helpful in understanding why devices stop functioning. Looking closely at the lead, there are 4 wires within, one for each electrode at its end. Now, let's assume the device is implanted and functioning normally. As current flows down one wire, it will flow out through the electrode attached to that wire. It then re-enters the lead through another electrode and travels back to the device through the wire attached to that electrode. Normally, the impedances measured for sacral neuromodulators range anywhere from 400 to 1500 ohms. Now, let's examine a device where the wires have crossed. This is referred to technically as a short circuit and can occur if a lead is crushed or subject to other trauma. With a short circuit, current flows down one wire and back through the other, never reaching the electrodes. Thus, neurostimulation therapy often loses efficacy when a short circuit occurs. Impedances measured with short circuits are generally very low, usually 50 ohms or less. Lastly, let's examine a device where a wire has broken. This is technically referred to as an open circuit or break, and can occur when a lead is stretched or subject to other trauma. In this situation, stimulation is ineffective, as current cannot flow due to the lack of a complete circuit. Impedances with an open circuit are generally very high, often 4,000 ohms or greater. Now that the basics of impedance, troubleshooting, and device function have been covered, here are a couple clinical scenarios illustrating these points and integrating the concepts. If a patient presents with a loss of sensation in the perineal area, the device is likely not providing sufficient stimulation. If this is due to minor electrode migration or electrode encapsulation by the natural immune response, patient sensation can often be restored by reprogramming the device. Again, these situations are why leads should be implanted using a mid to low range amplitude for localization, such that when minor migration or encapsulation occurs, the amplitude and/or pulse width of the device can be increased to compensate. However, if reprogramming fails, the device gives a malfunction message, or impedances are abnormal and suggest problems with leads or electrodes, revision of the implant may be necessary. However, prior to surgical revision, troubleshooting of the neurostimulator device should be performed. The first step in investigating any neurostimulation device should be to check the device for error codes. Assuming none are present, the next step is to check the circuit impedance, which will either be normal or abnormal. If impedance is normal, the stimulus strength can be increased by raising the amplitude or prolonging the pulse width. This may restore patient sensation and solve the problem. However, if not, it may be necessary to try a different electrode pair and change the amplitude or pulse width again, repeating this cycle until a reasonable number of combinations of stimulus waveforms and electrode pairs have been exhausted. If this is the case and sensation is still lacking, the device may need to undergo surgical revision. Going back to the initial impedance check, if abnormal impedance is measured, the electrode pair can be changed with the intention of utilizing remaining intact electrodes to successfully provide stimulation. Thus, once a pair of electrodes with normal impedance is selected, the stimulus should be adjusted by varying amplitude and pulse width, and if successful, sensation will be restored and the problem corrected. However, if unsuccessful, a reasonable number of combinations of stimulus waveforms and differing electrode pairs should be evaluated. Following this, if no intact electrode pairs and stimulus combinations have restored sensation, a device revision may be necessary. This video has covered the basics of neurostimulation and hopefully has helped strengthen your knowledge of the basics of this therapeutic technique. To conclude, a few key points will be highlighted. First, recall that depolarization, which produces action potentials, is caused by ions crossing neuronal membranes. Neurostimulation devices simply pump ions into neurons, causing action potentials to occur. Thus, neurostimulation is simply a therapy based upon triggering action potentials in neurons. Second, amplitude increases the flow of ions out of the pump or neurostimulator. Like a garden hose, these ions can be pumped farther to excite more distant neurons if the amplitude or flow of the pump is higher. Increasing pulse width increases the time that the neurostimulator is on or pumping ions. Increasing pulse width will help to stimulate thinner neurons within a given area, as larger neurons are the most easily excited. Lastly, bipolar electrode configurations target stimulation more than monopolar configurations, and thus are ideal for use when implanting leads, especially with amplitudes and pulse widths that are in the low to mid-range of those available for the neurostimulator device. Additionally, impedance is very useful for troubleshooting neurostimulators and identifying the problems with devices that have lost their therapeutic efficacy. This concludes our video. We hope it has helped reinforce your knowledge of the principles of neurostimulation. We would like to thank the following individuals for their time spent reviewing this material and consulting regarding the topics and content presented in this film. Also, for an in-depth text on the technical aspects of neurostimulation, we suggest the text listed at the bottom of this screen. Thank you.